Right. Welcome everyone. As I said, I'm Mary Brazier. I am the co-chair of the BASW England Mental Health Thematic Group, and I am the Director of Social Work for East London NHS Foundation Trust. And I'm very pleased to be able to chair the session this morning, which is moving from words to action in anti-racist practice. Next slide. So this is just about taking care of ourselves and one another. So this presentation will include some sensitive content, which may be upsetting for some people. Now, it may be difficult, but it's necessary to be able to have courageous conversations about difficult topics, including this one. We encourage you to care for your well-being and take time out of the session if needed. As I said, it is recorded, so you can always catch up later. The priority is to make sure that you're okay. We do want this to be a safe space, so please challenge the view, not the person. If you do have questions, think about how to do that appropriately and respectfully. We're all on a learning journey, so there's no such thing as a silly question. Please ask it. And then the agenda for the session. So Robert Lewis, who is the mental health lead in the Chief Social Worker's Office in the Department of Health and Social Care, was going to be chairing the session today, but was unable to attend. So instead, he has sent us a recording, which we will play shortly. Then we're going to be having a number of different presentations from colleagues. There will be a comfort break at about 11:05 if we're sticking to time, which we will try and do as much as possible. So we have a number of speakers today. We're really pleased they've been able to join us. I'm really looking forward to hearing their presentations. So we have Vava, Trisha, Hannah, Neil, Bonnie, Richard, Duke. There'll be opportunities afterwards, after we've had all our presentations, for the Q&A sessions. And we really do want this to be a little bit interactive, so that we are expecting, as I said, pop the questions in the chat and we will refer to those during the Q&A. But where there's an opportunity to pop your camera on and also use your microphone and ask questions directly, it's much better if we can have sessions as interactive as possible. Okay. As I said, due to unforeseen circumstances, Robert wasn't able to join us today, but he has provided the following recording, which we'll play now before we'll move on to our speakers. Hope everyone finds the session today really informative and interactive, and I'll look forward to seeing you shortly.
Hello, everyone. Thank you for joining us today. My name is Robert Lewis, and I'm the Mental Health Social Work Lead here at the Department of Health and Social Care, and I work in the Office of the Chief Social Worker for Adults. Firstly, I'm so sorry I can't join you in person today. This is due to an urgent personal matter, but I'm really pleased to be able to at least provide some support through this message for the proceedings today. I'd really like to just express my gratitude to Denise Monks at BASW for supporting me so late in the day, and to Mary Brazier for stepping in to ensure that this event could still go ahead. And I'm grateful also to the colleagues at BASW for agreeing to make this event free of charge to non-members, and it really shows their continuing commitment to anti-racist practice. I'd also like to extend a note of personal thanks to all of our contributors today who are giving up their time to support this event. I know there will be so much you can take away from them today, so thank you to everyone who's involved. And I know just how busy we all are, how everyone is, and but this is really important work and subject matters. So I'm also grateful that so many of you have chosen to join us today to hopefully learn, to reflect, and contribute as well. That would be great. So the origins of today's session goes back to October 2023's Anti-Racist Perspectives and the AMHP role. This was a webinar hosted by BASW and my predecessor at the department, Jason Brandon. That session had been put together with the support of the National Approved Mental Health Professional Leads Network and colleagues from across the mental health sector. Now, this webinar, I think, was hugely successful. We had lots of feedback about how thought-provoking and impactful people had found it, and we've wanted to return for some time to the subjects. So this is our opportunity to do that. And when we were thinking about this session, we recognise that racism in mental health service goes well beyond the Mental Health Act. And the racial disparity that we see every year in the detention statistics. And we know that, the evidence of how poor the experience is for those who find themselves detained or subject to our attention. So we also wanted to shine a light on the experience of our colleagues from global majorities in the workplace. So today we have invited a much broader audience to join us and explore these issues together, along with some of the themes from before. In the previous session I mentioned, we'd heard from Dr. Colin King from his lived experience, professional and academic perspective on the racist foundations of mental health systems, psychiatric language, treatment, and the assumptions inherent within the legislation and practices around detention. We had Dr. Caroline Lee talk about the progress with the Improve Act research on the experience of Black African Caribbean men detained under the Act. That research is now completed and is freely available, so please seek it out, read it and share it with colleagues if you can. Perhaps we might be able to put a link into the chat towards that. We also heard a conversation on allyship between Neil Samuel and Chantel Thomas, key leaders in promoting our understanding on the value of allyship in our professional, and I would also say personal worlds. Neil is with us again today, along with Hannah from the City of York, to demonstrate how these allyship ideas can take real shape within our organisations. And we also heard from Dr. Jackie Dyer and Hasnara Malik on the anti-racist framework, PCREF. For those unaware, the Patient and Carer Racial Equality Framework, which is now a requirement for all trusts to ensure a meaningful feedback loop between services and those who draw upon them as a mean to improve both the experience of those individuals and improve the services provided. So if you've not seen the previous session, again, hopefully colleagues might be able to put a link up for you to have a look. It's well worth your time and to watch, but you don't have to have seen that session to understand what we're trying to do today. So in putting this session together, it's clear we didn't want to just restate the impacts of racism, and while we must still keep these narratives alive and not lose sight of why this is so important, we also wanted to demonstrate and give hope to how we can move from words to actions, and words into action is our theme today. As I mentioned earlier, an important addition to our content is some further exploration on the experience of racism for those racialised and global majority colleagues from within our own organisations. It's important to recognise how organisational culture can affect our efforts. I remember many years ago when I was working in a community mental health team, a nurse colleague of mine was commenting on a big push that we had within the trust. And my colleague sort of said something along the lines, the trust is making a big show about us wanting to work in a recovery-focused way with our service users, but they don't know how to work that way with us. Or as I think I replied at the time, something along the lines of nice window display, shame about the empty shelves. It's something that really struck me from what he said, and it's relevant when we think about our organisation's commitment to such shifts. For example, moving from a non-racist to an anti-racist position, for example. And it reminds me that we need to have vigilance with our organisations who often can say the right things externally, but fail to engage colleagues internally and apply the very same principles that they are seeking to make such a virtue of. So it's incumbent upon us to engage with that and to support our organisations. And this does seem even more important now. While the murder of George Floyd was a catalyst for Black Lives Matter and so much else, and became that kind of galvanising focal point and a call to action, we have witnessed a concerted political pushback since, whether through the so-called culture wars that dismissed and degraded demonstrations of support for Black citizens, or through the rampant and unchecked social media hatred which fanned the flames of last summer's riots and seek to fuel discontent and disagreement between us. And during those moments, particularly during the riots, when our global majority colleagues expressed sometimes for the first time their fear at walking on their own streets, or the fear to live in their own countries because of their colour of their skin. It did make me think, what did our silence in the workplace convey to them? Did we show sufficient solidarity and support? Did our organisations remain quiet? Had we truly grasped the issues being placed in front of us? I'm pretty sure now that I didn't do enough in my leadership role, and I know my good intentions at the time had really offered neither me nor anyone else much comfort. And this geopolitical situation is not getting any easier. We have open hostility from the Trump administration towards equality, diversity and inclusion. We've got sways of references to colour, representation, achievements, resources and shared sense of history are being removed from US government websites and institutions, while they are also defunding programmes in the US and abroad that have any perception of a link to addressing inequality. They're even blaming planes falling out of the sky on EDI. And then domestically, in the last few weeks, we've had the Reform Party leader openly taunting colleagues to go and find another job if they work in EDI in the councils that they now control. So we do have law on our side, but we also know that societies can turn quickly on their institutions if people don't speak up and out, if we don't push back, if we don't work together, and if we don't demonstrate why this is important. So we will look at the experience of our global majority colleagues today, what our systems can do and are doing to support those colleagues. We will also look at the opportunities to promote allyship, advocacy and representative leadership. And it is fitting that that the work we are able to do in our communities is ultimately the focus today. I'm delighted that we've got our colleagues from Brent who will share with us some of their community-based and co-produced work. After all, this is what brings us into the work in the first place, and in days like today, helping to improve the lives of citizens, ensuring that what we do is what they need and want, that provides meaning and feels relevant. So, to be incredibly cheesy and to extend my shopfront metaphor from earlier, I do hope we can use today to fill those empty shelves, to celebrate the good work we do, to take this opportunity to gain some more insight and allow ourselves to draw some inspiration from the brilliant contributors that we have today. So let's turn our meaningful words into meaningful action. Thank you.
And thanks to Robert for setting the scene for today's session. Without further ado, I will introduce even our first speakers. So I introduce Vava. Vava is the chair of BASW England, and he's the deputy head of social work and social care at CNWL, that's Central North West London NHS Foundation Trust. I'll hand over to you, Vava.
Thank you very much, Mary. Lovely to see you. May I record my gratitude to the Department for Health and Social Care and the Office of the Chief Social Worker and Robert Lewis for organising this incredible session. May I also extend my gratitude to everyone who's made time to join us this morning on this very significant subject. Should we move to the next slide so we can kick off, please? Well, I suppose the key element I wanted to highlight here, it's the last line, which is in my previous role, I was the racial equity czar in Brent, Harbour, Westminster, and Kensington and Chelsea. So racial inequities, I'm a mental health social worker. I'm also an AMP8, something which is very, very close to my heart. And we have placed it on the agenda, at the heart of our agenda in BASW England. Should we move to the next slide, please? Now, I think maybe gave a health warning before. As a country, as a society in England, we struggle to talk about anything in relations to equity or equality. And there is this book I've been reading, which is really, really fascinating. And I wanted to share a quote from this book. The book is called "So You Want to Talk About Race?" Very much a questions and a statement at the same time. And in that book, this quote essentially, what the argument she's putting is that you have to get over the fear of facing the worst in yourself. And this line, getting over the fear of facing the worst in ourselves, would resonate later when I show another quote from another book, how to be an anti-racist person later on in my session, in this talk. Essentially, the argument here, this is a very difficult subject. As a society, we have not been trained or socialized to talking about this, neither in school, neither in secondary socializations or at home. But we have to find a way to talk about this because it's the one key element which continues to shape life expectancy and life chances in our society for many, many of our citizens. Should we go to the next slide, please? Now, often when we talk about racial inequities in society, we talk about things downstreams, things which people like me and many social workers in the room and arms in the room would have witnessed, would have seen, or would be concerned about, which those are things such as, detentions under the Act. Black people, as we know, about 3 to 4 times likely to be detained under the Mental Health Act, under the civil part of the Mental Health Act. About 11 times, I think now it's 9 times more likely to be placed on CTO, which actually has been shown to have no therapeutic impact at all. It has no therapeutic impact at all. But for some reason, Black people are 9 to 11 times likely to be placed on CTO. 136 psychosis diagnosis, which is a death sentence because it shapes everything. It shapes your relationship to yourself. It shapes the way your GP sees you, the way the police interact with you, the way your employer sees you. It shapes everything, the way friends, the way partners, children, everyone connects with you. If you're Black in the UK, you are 4 times likely to be diagnosed with psychosis. And there is a study which has been carried out by UCL in London. And in that study, they looked at and at the moment also to add, in England, we diagnose Black people with psychosis more than any other country in the world. And the study from UCL, which I'm going to find the link and I'm going to share it here, essentially what looked at data in England and looked at sort of data from nations where those people came from to kind of see what's going on. If Black people are more likely to be diagnosed with psychosis in England, then you would assume in our countries of origin in the Caribbean, in Africa, other places in the world, there would be a pattern of similar diagnoses. And that study found none, which essentially suggests there is something about the water we drink, about the food we eat. That's a metaphorical way of sort of saying there is something about the way we practice in England, which essentially leads to more Black people being diagnosed with psychosis. Restraint, another element, seclusion, PQ admissions, and so on and so forth. So those are things down the stream, which we as social workers and often see. What we often, and what as a society, where we have failed or where we are failing, is actually to also look at things upstream, things which essentially lead into more people presenting to secondary mental health services or to our A&E department and so on and so forth. So we know, again, in England, black children in some boroughs in England, in some local authority, are 6 times likely to be excluded from school exclusions. And there was a study carried out at SLAM, where I'm also a NED, and in that study, they look at sort of their population in their medium secure unit, and the one single element every single human being detained in their medium secure unit shared in common was school exclusion. It turns out that school exclusion does not simply shape your life chances. It also shapes your mental health. It also shapes your health overall. So school exclusion, stop and search. If you're a Black child, you're 6 times likely to be stop and search. And CAMS is another element. If you're Black, study shows that Black children are 10 times more likely to be referred to CAMHS via youth justice and social services than their GP, which is really, really concerning. And to that, you also need to look at sort of the list of people open to CAMHS. Interestingly, whereas you see a lot of Black people being open to secondary mental health services, when it comes to CAMHS, study shows that the population of CAMHS which are Black children or minority, it's only 5% across England. So there is this incredible disparities between things upstream and things downstream. Should we go to the next slide? And one of the things I've been doing is sort of trying to understand what could be, what is the hypothesis for these issues? What is leading to these issues in our services, in health and social care particularly? And one of the things from personal experience, from a professional experience, I feel there is a combination of 5 key elements which is producing inequities in our services. So you have poor data collection and poor data triangulation. We are not always collecting good data, and we are not always triangulating what's happening, upstream and what is happening downstream. So there is that massive issue that needs to be addressed. There is poor internal and external accountability. We have NHS trusts across the country which are, providing what would be seen quite clearly to be poor services to our Black and minority populations. But yet, so far, that seems not to be an issue for CQC. CQC, when carrying out the inspections, it hasn't been picked up that actually the way you're providing poor care, more restraint or more seclusions and so on and so forth, that is a concern that needs to be addressed and so on and so forth. So there is that incredible massive poor internal and external accountability. There is also poor system approach. There isn't a system approach to all the health inequities we're experiencing in society. We tend to deal with things simply when there is a concern, when a concern has been raised, when there is a safeguarding report showing that, for instance, the racial element in safeguarding of children who are Black and minorities and so forth. And there is also an element of poor statutory compliance. As all of us, services that use public fund, we are required to provide services that meet certain standards under certain legislations, including human rights. And we know, for instance, when it comes to restrictive practice, when it comes to seclusion, when it comes to restraint, those are issues which are directly engaging Article 3 of the human rights, because this is about inhumane treatment in one way or the other. In fact, there was an argument advanced by the UN, I think a year or 2 years ago, in relation to our mental health services, that we are breaching a lot of human rights. So there is that element of post-statutory compliance that needs to be addressed. And then there is the 5th element, which is really, really critical, which is denial and avoidance. And this is something we all in England subscribe to. We find it really difficult to talk about these issues, to address these issues of concern. So there is often a lot of denial and avoidance, avoiding talking about the elephant in the room, or denying that actually the services we're providing, it's racially inequitable. And when you have a combination, I feel, of all of those 5 key elements, where you find yourself, it's services with a lot of racial inequities in access to services, experience with services, and outcome from services. So outcome things about CTO and diagnosis of psychosis and so forth. Experience, think about restrictive practice, think about restraint and seclusions and rapid tranquilizations. And access, think about CAMHS, think about all those key elements, in terms of CAMHS. Should we go to the next, Beth? Now, I've talked about some of the depressing elements, but what is really, really critical, I think all of us as mental health professionals, there is something which we really need to invest a lot of time and effort into, because it has tremendous potential to doing us a lot of good in society. So in 2017, when then Prime Minister Theresa May was still in power. She was briefed about the Mental Health Act, about detentions under the Mental Health Act, and she was appalled by the numbers of people of Black and minority people being detained under the Act. And you and I know it takes a lot for a Conservative Prime Minister to be appalled by anything. She was appalled and which led into essentially commissioning the review of the Mental Health Act. So many of us in the room are aware that there is a new Mental Health Act going through the legislative processes in Parliament. I think last time I checked, it was still in the House of Lords. And that essentially was triggered by Theresa May. Simon Wesley was, at the time, I think, the president of the Royal Society of Psychiatry, led that commission, that review of the Mental Health Act. And one of the recommendations of that review is something called PCREF. PCREF is the baby of a dear sister of mine, Jackie Dyer, Dr. Jackie Dyer. She's been pushing for this for many, many years. So PCREF was adopted as one of the key recommendations. And PCREF is now a requirement for all of us across England to essentially ensure our services have successfully implemented PCREF. PCREF stands for Patient Carer Race Equality Framework. And what PCREF becomes essentially is going to depend on us as social workers, as AMPs, as leads in our different services, whether or not this is going to be simply window dressing to show that actually, there is window dressing. We have done some work on PCREF, or whether or not we would actually fully commit ourselves to doing the work to address the racial inequities in our services. Beth, should we go to the next slide? Now, I mentioned PCREF, and this is really critical, and I'm showing this slide in part because you can see the picture of my chief exec, Claire Murdoch, who until recently, until NHS England was disbanded, was also the director of mental health in England. And when PCREF was launched, Claire Murdoch and Tim Kendall essentially described PCREF as anti-racist. This is the first ever NHS England or NHS anti-racist framework. So it's really, really significant. But we also know, I'm also concerned and aware that because of pressures in our services, often you have a lot of good things and good, staff initiatives coming from the centre, being pushed down to us on the front line. But because of pressures in our services, we always do not embrace it or implement it. But PCREF is really, really significant, really, really significant. And if we implement PCREF fully, there is a chance we could begin to address the racial inequities in our services. And if you have questions on how to do it, Jackie Dyer is one of your first person to go to. And if BASW England can be of support, do reach out to us. I'll be able to provide support as well. Bev, shall we go to the next slide? Now, we talked about anti-racist, and I spoke to you before about that book, So You Want to Talk About Race, and the first line of that book, the first line of that quote, essentially being about facing, the worst in ourselves. When we often, as a society, when we talk or when we think or imagine or reflect on what is racism in society, what comes to mind to many of us is, the KKK, some element of maybe the Reform Party, or some element of the British National Party, or the race riot we saw in England, I think a year ago. All of those are correct, but not enough. And this is something which myself coming to terms with. There is this book, which is really, really significant, really, really important, How to Be an Anti-Racist. And in this book, there is a thing which has been advanced, which I think all of us need to approach. And this argument has really shaped my thinking about the whole idea of what is white allyship and so on and so forth, and all of that. And so to be anti-racist, it's basically the recognitions that to grow up, or to be born or to grow up in a Eurocentric society, is to, at some point in our lives, internalize ideas and policies and practices that produces and normalizes inequities or racial disparities. And that understanding I found it really, really profound, because, you know, one of the racial inequities that we have normalized, all of us we are aware of, but we have normalized, we do not question this. For instance, stop and search. You know, it has a massive impact on children's mental health, on Black children's mental health, and so on and so forth. But as a society, we have normalized it, and it continues to have its impact. School exclusion being another one in some local authorities in England, having, you know, Black children being 6 times more likely to be excluded from school. A massive impact, and study shows that when a Black child and a white child present in the same way in a school, you know, being naughty, to use a lighter word, the white child will be referred to CAMS and the Black child will be excluded from school. So those are inequities or practices or ideas which all of us in society, Black and white, or whatever color we define ourselves as, we have normalized. And because, you know, and those policies do produce racial inequity. So to be an anti-racist is that recognition. And this is to say, you know, I think if we adopt this kind of thinking in relations to being anti-racist, it would enable us to really look ourselves differently and to do some of the hard work that needs to be done. Beth, next slide, please. Some suggestions quickly. I can see Mary waving her hand politely in the background. You know, some of the things that you could do on your side. You know, you're both committing to becoming an anti-racist, really, really critical. You know, you know, we are going to share all of this to all of you, but you know, becoming compliant with some of the statutory regulations, tackling some of the disparities, becoming culturally aware, you know, co-learning. You know, one of the things I used to do is when I was a team manager, whenever someone in my team was detained, after their detention at the hospital, we would invite them to some of our MDT meeting and actually, you know, speak to them for them to tell us what we did right and what we did wrong. You know, how we could have picked up that they were deteriorating, what are the things that we missed out, and so on and so forth. So finding ways of co-learning and co-producing and so forth. Beth, the next slide, please. Now, this is a final thought from Martin Luther King, you know, back in the 1960s, and which still speaks to reality today, which is, of all forms of inequities, injustice in healthcare is the most shocking and inhumane. And you know, it's one of those quotes which I always tell people when I'm presenting or doing training. And the next slide, Beth, which is some of the books I have been going through, which I would recommend you to share with your colleagues in your trust. You know, yeah, really, really informative in shaping the way I see things and the way I understand things. If you want the top sort of 3 for you to read, definitely read White Fragility, a really, really significant book. It allows you to understand whiteness in a way that you'll be like, oh, that's really, really interesting. I never thought of it that way. Read How to Be an Anti-Racist. Really, really, really significant book. And perhaps the last one I would advise you to read is Madness, which is based in relations to the US, but has a lot of resonance to our society in England. I think that's it for me, Beth. The next slide is simply Q&A and some of the references. But yes, thank you very much. Over to you, Mary.
Thank you, Vava. Wow, expertly setting the scene there for why this work is so important and this session is so important. And I think particularly I'm approaching this as someone who's not from the global majority and really wanting to emphasize that doing nothing is not an option. Being passively non-racist ourselves, not an option. And the responsibility for addressing these issues doesn't just sit with our friends and colleagues and communities who are from the global majority. So I'm really looking forward to the rest of the sessions, but thank you again, Vava. And remembering Q&As, questions in the chat, and we'll come to them after the rest of the presentations. Thank you. Right. introducing our next speakers. So we have Tricia, who is the co-chair of the Social Care Workforce Race Equality Standard Independent Advisory Group. And Tricia is here with her colleagues Mira, Patricia and Grace. So handing over to you.
Hi, good morning, everyone. Thank you, Mary. I hope you can hear me okay. Yes? Great. Yes, so I'm Tricia and I'm a social worker by background, and I'm co-chair of the Social Care Workforce Race Equality Standard. Previously, I was the Director of Operations at Skills for Care, and Skills for Care are the custodians. They host the Social Care Workforce Race Equality Standards. And as Mary has said, I'm joined by my colleagues this morning, Mira, who's a former Director of Children's Social Services and an author, has written many publications and books also, and my colleagues, social workers Grace and Trish, who are participants on a leadership programme that I'll share some more details about in a moment. But this session we will talk briefly, sharing our experiences of leadership and what we are doing and what we have done to move from words to action, anti-racist leadership, and also reflecting on being Black global majority leaders in social care as well. So to start with, the Social Care Workforce Race Equality Standard officially launched on April the 1st, 2021, and it was across 18 local authorities in its first phase. And the Social Care Res is designed to improve anti-racist workplaces and anti-discriminatory practices within the social care sector. So there is an NHS Res that's been around since 2015, and this evolved from the NHS Res. And the main goals of the RES are to address racial inequalities. So the programme collects data on 9 key indicators that you can see on the slide there. And the indicators highlight disparities in career progression, disciplinary actions, and representation in leadership roles. It also aims to support local authorities to be anti-racist, because it provides a framework for local authorities to develop their action plans that provide a more equitable work environment. So you can see from the data collected just the landscape of your organisation, and then you can develop the action plans of how you're going to progress change. So by that, it aims to improve workforce diversity. By tracking the metrics, it helps to look at fair opportunities for staff, global majority staff and minoritised ethnic staff as well. And it encourages accountability because the data is transparent. So participating organisations have to report their findings to implement changes based on the data that they have collected. So it started with 18 local authorities, and in 2024 there are now 73 local authorities who have implemented the Social Care Res and provided data about their adult and social care workforce. Now, not all local authorities collected for adults and children social care. Some focused on adults, some combined with adults and social care. So 43 out of the 73 local authorities that have participated, they provided combined data for children's social care workforce as well. So that's nearly 98,000 staff across those 73 local authorities. That's 58,600 in adult social care and 39,300 working in children's social care. And I'm not going to go through all 9 metrics today, but I wanted to share just some high-level findings from the indicators, and it's really worth you reading the report which was launched last week. So with regard to pay bands, we know that global majority staff are less represented in the highest pay band compared to lower pay bands. That's of no surprise, I'm sure. And that disciplinary processes, again, global majority staff are 37% more likely to enter formal disciplinary processes compared to white staff. And actually, it increases slightly for children's social care than adult social care as well, and fitness to practice. Now, fitness to practice, only 27 of the 73 adult social care local authority data sets presented data, and only 17 of the children's social care organisations presented data. So there needs to be an increase in how organisations are collecting data, as well as not only fitness to practice, but data collected around harassment, bullying or abuse from that was lower in numbers collected from across all the local authorities. But for the purpose of today's webinar, we are going to focus on indicator 9, which is the lack of diverse senior leadership across local authorities. Because as Vava said, we know that Black people are around 3.5 times more likely than their white counterparts to be detained under the Mental Health Act. Next slide, please. So we know that when senior management lacks representation from diverse backgrounds, it can lead to, I think you've gone a slide backwards and it should be the other way. Yep, click and click again. Thank you. So when senior management lacks representation from diverse backgrounds, it can lead to a narrow perspective that fails to really fully understand and address the unique challenges faced by ethnically minoritised people. And as we know, this lack of diversity results in policies and decisions that do not adequately reflect the needs and experiences of people and communities, leading to poor outcomes and perpetuating inequities in service provision. And an absence of the diverse voices in leadership can contribute to a culture that is less inclusive and less responsive to the needs of all staff, which can undermine any effort to create supportive, equitable workplaces and an anti-racist workplace. So ultimately, the lack of diversity in senior management not only affects the quality of services that are provided, but also reinforces the systemic inequalities and hinders progress towards a more just and inclusive and anti-racist workplace and society. And so the Independent Advisory Group are working to support visibly diverse leadership. And I worked with Research in Practice to develop and deliver the Department of Health and Social Care funded Principal Social Worker, Principal Occupational Therapy and AMP Leads Leadership Programme. Importantly, the programme was open to global majority people aspiring into those leadership roles. So we're looking at the talent, we're looking at succession planning, and we're looking at leadership for the future. And the programme had a focus on being an anti-racist leader. And so importantly, as we work in organisations that lack congruence and cause harm, the programme provided space for global majority leaders and aspirant global majority leaders to thrive. So around 60 professionals, all working and learning together with a commitment to progress anti-racism within their professions and their organisations, and committing to make change and better outcomes for people who draw on social care and support and their colleagues. So now I'm joined this morning, as I said, by my colleagues and friends, and I'm going to hand over to Mira, who's written a lot around leadership, but also Grace and Patricia were participants on the programme and they will share their experiences. So Mira, it's over to you now. Next slide.
Thank you, Tricia. I'm aware of the time, so just bear in mind the whole thing around the fluidity of language. We talk global majority, we talk other things. Sometimes I think it can be an exercise where it's a displacement exercise. We just need to keep know what we're saying and why we're saying it. And minoritised is much better than saying minorities. So next slide. I just want to talk to you about something that I wrote in 2014 on the back of the commencement of the Black and Asian Leadership Initiative, BALI, which is now over a decade old. And I wrote this having seen and spoken to the aspiring global majority leaders that were in the rooms with us. I just wanted to show you this one thing. And this one thing is about, actually, I could publish my 2014 paper and it's broadly the same. So Black leaders and Asian leaders are still missing in action. So on the right-hand side, you've got all the imperatives that every leader who is coming up into senior leadership roles will have. So there you can read that. However, on the other side, you see Black and Asian leaders, additional expectations placed on them, whether they want it or not. So, of course, you will have the perceptions of white staff and partners and politicians that you have only been the diversity pick. And already they're taking away that merit, that confidence that people need to have when they are senior leaders. You then have the anticipation and hope of all the Black people and I use Black in a political sense, who have experienced racism in their organisation, and they look and they see someone like them and they want them to try and sort out the racism that they have been having for years. The same with expectations from Black communities. Definitely they will come to people who look like them in a place of power. And again, things can happen like I had a group that wanted me to look at planning for the Gurdwara, and actually I was director of children's services, but they, the politicians put people in front of me because they are looking for that kind of help and support, because they know what everyone's been through. Expectations that you will lead the equalities agenda. Any moment where people mention it, all the eyes turn to you, and you're usually one. In senior leadership at director, chief officer level, you're usually just one. And then you've got family expectations. And some of those expectations can be about being worried that you are going to experience racism because you have put your head above the parapet and you are now in senior leadership. So just recognizing a few of the things here, just in that one slide, we know that global majority individuals are experiencing covert and overt racism in those kind of spaces. So no wonder there aren't many that are reaching that top, and certainly not 2 or 3 in a chief exec's room. They are gaslighted. We are gaslighted to keep us off balance. Oh, didn't I send that to you, Mira? I'm sure I sent you the email. I knew they hadn't. Other examples. We can be undermined. We can be silenced. We can be consistently negatively reframed. So if you're excited about something, then they'll say, oh, well, she's just too much. She's just too much. She's not someone we want to work with. So despite the wealth of experience that they have in terms of global majority leaders, and they bring such additionality to this, they are often overlooked for appointments. They are often given very weak generalized feedback that you can't do anything with. So you're still trying to do this. And in terms of the implications of this from a mental health perspective, the additional burden of having all those things on that side, systemic racism can lead to hypervigilance. So you're keeping yourself hypervigilant because of all this stuff that's going on. And that means it induces hormones, including cortisol and adrenaline. Sorry, I can't say that. And basically, stress can trigger trauma. There's a good report from from NICE in 2024. I'll put it in the chat. They identified that stress and adrenal hormones have long-term impacts on the body and the mind. So I'm passing over very quickly and on to my colleagues.
Hi, good morning. So thank you so much for giving me this opportunity to talk. So here in BCP Council, what we are doing is we are actually moving towards, we are moving from words to action. As one of the participants from the aspirant leader from Global Majority, what we did is, after I finished my my leadership course last year, I actually take up on an appreciative inquiry within our organization. And some of the outcomes that we did find as a group from Black and Asian minority, we discovered that systematic racism is not about, the workplace that we work. Sometimes it's actually about individuals. We identify that not all teams actually experiences racism, but it was to do with other managers that were not equipped to deal with people from Black and Asian minority who didn't have cultural awareness. So what we have shared is, as a group, moving forward, we are trying to change the policies that we have around our workplace. We have been given opportunity to meet as a group. So at the moment, we are actually looking at changing the words that we use, especially when we're actually doing our trainings. We have the EDI training, and we've realized that when you have those trainings, most people from Black and minority do attend, and our white colleagues don't attend those trainings. So we are actually changing from EDI training to anti-racist training so that everyone can actually attend those trainings. We also looked at how how the organization can actually help us to fight racism. And the good thing is our director, she's actually into it. She's also helping us to fight that. So we have also noticed that when our clients some people don't want to work with Black and Asian minority colleagues, they'll actually say, I don't want to work with this person. So what we've asked our managers to do is to support us, because this is about providing a service, not actually looking at the skin color of who is providing the care. So we are actually trying to change our customer charter, the policy, the customer charter, the wording that is in there, to actually talk about racism, not just discrimination. We have also come up with some trainings that we have identified as a group that we've actually offered our workforce to actually implement within our organization for managers and also for our colleagues. So as a group, I think this leadership course, what it has done to me was to empower me to take upon the leadership skills that I didn't actually think I had before. I actually went on this course, but only what I wanted was to be empowered, to embrace what I already had, and actually to understand myself and my identity and my ability. And after that, all what I can tell you is I am trying to implement everything that I've learned and to fight against racism within our workplace. We have also asked if we can have mentorship programs and coaching programs, because we've also picked up that in our workplace there are our white colleagues who actually got this position where they are actually mentored, and we didn't actually realize that there is something like that. So we have actually asked if we can actually be part of that mentorship programs, so that we can actually support each other. We can also support each other and be supported to move up to those leadership roles. And
thank you, Patricia. I think Grace is ready to come in now. Thank you.
Okay, thank you, Grace. Thank you.
Thank you, Tricia. So I'm Grace. I work in Darlington Borough Council in the Northeast, and I was part of the leadership program as well. And I think what I got from it, what we found is there is that lack of networks in terms of global majority aspiring leaders, and that's what I found in the leadership program. And it actually gave me that kind of safe space to have discussions and learn from others who are in those senior leadership positions. And in terms of my own reflections, it gave me the confidence to step up I've stepped up into a fixed term post as team manager, which is something I wouldn't have had the confidence to do before that program. But as a local authority as well, when I joined, I've noticed 5 years ago, those conversations weren't happening, and it's something that's on the agenda of our senior leadership team and sort of moving up and mapping into their corporate agenda as well. So we did the self-assessment, the diverse by design part of the EDI, and recognized those gaps in services. We now have two colleagues who are experts in practice on anti-racist practice. They've been doing training alongside the principal social worker in smaller cohorts in teams, but also in the staff forum. And that's linking into kind of global sort of regional networks in the Northeast. They've got protected, dedicated time to focus on that apart from their sort of day-to-day work. So, that shows how much the local authority is supporting that and looking at how that can be linked into kind of the recruitment agenda as part of the Black and Ethnic Anti-Racist Action Plan within children's and adult services. And I think we recognize that, we are champions of social justice and advocating for our service users, but also there is that gap in terms of our colleagues and in terms of the workplace and the importance of embedding that in our day-to-day practice and within sort of the culture of how we work as a local authority, and that's something that's being promoted. There's also been a staff forum that's been set up, which is something that wasn't there before. So, that will enable staff to have that safe space to speak up those networks and hopefully encourage other people to come into the local authority because, there is a very small representation of people from Black and ethnic sort of minorities, but also, that's representative of the population that we work in. So that's something that they've recognized that we need to link in those community groups and see how we can reach those other communities as well and empower the rest of the workforce to work and support the service users within our local authority, but also within our colleagues. So that's something that I feel, as a local authority, we are moving from words to action. And I can see those positive changes and those conversations happening more transparently, more openly, and also the support that we get from our senior leadership team and how they are embedding that into the organizational culture.
Thank you. Thank you, Mira. Thank you, Trish, and thank you, Grace. So you can see how the programmes, and as Mira explained, really supports not only global majority people who are aspiring into leadership roles, but the importance of having the support that so that they are thriving, because we are constantly dealing with the microaggressions, the undermining, the gaslighting behaviours. But the programme brought together white leaders and global majority leaders and aspirant leaders across our professions to really ensure that we have the diverse perspectives in future leadership roles. So thank you very much for letting us join you this morning.
Thank you.
Thank you very much, Tricia, Mira, Grace, Patricia. Really powerful session there. And just my reflections, starting off with the statistics, really visibly demonstrated, frankly, whenever I see, particularly of local authority leaders, I've found it's very visibly very white. It's often literally stark. Now I'm very lucky in that the trust, the NHS trust I work in, has a very visible leadership from the global majority. Our chief exec is a Black woman. There are other exec colleagues from the global majority too. And I'm very aware that and I think this has kind of just highlighted that the additional responsibility and pressure that's placed on those leaders, I think as the examples that Mira and colleagues particularly gave, is that when I'm looking at organising staff conferences for our group of social workers within the trust, one of the things they'll comment on is that they like to see people who look like them. It gives them hope. And this has made me really reflect back on how it feels to not only be doing the day job and doing those really stressful, responsible senior leadership roles, but also being expected to carry that responsibility of supporting others who look like you into senior leadership roles. So yeah, really, really powerful then. And then thinking about the experience of racism from service users and carers. and our responsibilities as leaders to do something about that. It's not okay. So yeah, plenty of food for thought, certainly, that I've taken away from that, and I would imagine everyone else has as well. So thank you again to Tricia and colleagues. So I'd like to introduce Hannah and Neil, our next speakers. Do you have your cameras on, Hannah and Neil?
Yes, I have. And
yes,
unfortunately, my name's been missed off the title slide.
Fabulous, thank you. You just weren't popping up on my little screen, so I was just double checking. Welcome, welcome. So Hannah and Neil will be introducing themselves, but Hannah is the approved mental health professional lead at York Council, and Neil is a social worker and another approved mental health professional who works part-time for Hampshire County Council and has practiced as an ASW and AMP for 31 years. Do you get an award for that, Neil? I think one should be coming.
It's actually 32 in a week's time.
Wow, congratulations on your imminent anniversary. I'll hand over to Hannah and to Neil for our next presentation.
Thank you. So if I can just start this we wanted to do the session to provide continuity and a kind of report back for those who attended the October 23 session that Robert described, where Chantel Thomas and I gave a kind of what went down very well, chat with each other about where allyship was up to for us. And I had only just embarked on delivering training around the country on anti-racist practice and allyship. Since October 23, I have been around all sorts of places: Shropshire, Staffordshire, Hull, York, Newcastle, Middlesbrough, West Berkshire and North London. So I've kind of taken the message of legacy of empire and whiteness, and then allyship as a way of trying to move forward in anti-racist practice. It's not the only way, but it's what I've been delivering out there. So Hannah and I came across each other in about October 23, and she was doing a project on recruitment and retention for AMPs nationally. And she'll say more about that journey in a minute. But she invited me up to do my training in New York, and we both decided to do this as a joint training day, where it would model racialized minority person, that's the terminology I use rather than global majority, and a white British, in fact, with roots in Lithuania. So to kind of model that joint working. So I'll hand over to Hannah now to talk about her journey. Unmute yourself, Hannah.
Sorry, apologies. Yeah, I'll just start by saying that Robert asked me on this occasion to share the work that we've done in a way that would demonstrate to frontline social workers how to move forward towards active allyship and anti-racist practice. So we've heard some great stuff from Vava and Mira and Tricia and others around the importance of leadership. Neil and I have done training on that as well. The importance of leadership in enabling, cultural change and tackling structural racism. But we really wanted to focus on the frontline social workers who may feel as though they don't have as much power in their organisations in order to tackle things, and the infrastructure might not be there. There might not be the allyship forums. There might not be the anti-racist policies in the induction and in the supervision. We do live in, as Vava said, a very Eurocentric society, and while there's a lot of work being done, we felt that this was an important area to focus on. And I'll also acknowledge that I am a white woman and I am in a leadership role currently. However, it's looking at the journey I've had and how I tried to tackle things, whilst also not being the most powerful person in my organisation, and in a very white city where the word race isn't mentioned very much. I would say that
the slide needs to move forward.
Yeah.
To number 3, I think.
Okay, not just yet.
Okay.
And I'd also say that York, the city that I'm working in, and the area we're working in, and the work that we did, has been identified as structurally racist, and there is a 5-year anti-racist strategy, but that hadn't yet reached down to adult social care and to frontline social workers. So my journey was about challenging that. I think, Neil, we wanted to talk about the importance of safe spaces, didn't we?
Yes.
And
can I say something about that just a little bit first?
I do, yeah.
So in all of my training days that I've delivered, I have tried to ensure that from the very beginning, people felt it was a safe space to make comments and share in group discussions and kind of explore these quite difficult issues. As Father said, no, people don't like talking about racism. So I made a lot of efforts to create that and ensure that people felt it was really safe. So, okay, Hannah, over to you.
I would say the thing that I added in there, because absolutely they're all really valuable principles, as a white person, is about being brave and leaning into your discomfort. And as a leader as well, and probably as a social worker, I wanted to create an environment where we established at the beginning that you may feel uncomfortable with what you hear, but that needs to happen as part of your journey. You need to hear that. And if we don't lean into our discomfort, we don't move forward. So if we could move to the next slide, please. So Neil brought this when he did the training, and I thought for the practitioners that are on the session, there may be people that are already very active allies. I'm not sure what the audience is, but I like this slide because it talks about the things that you need to be an authentic ally. I won't go through them, but I just thought it's about appetite, asking questions and being curious. Accepting there's a problem is a really key thing. Acknowledging that it needs to be addressed, depending on who you are, apologising, as a white person, I need to apologise. We'll come on to that. Don't make assumptions about people, and taking action. And we'll just come back to that slide later on and just review that a little bit and see where people think they are. So the importance is that during this session, you take time to reflect on where you are on your journey as an ally, and how far forward you think you are. So the next slide, this is my journey. I lived in Bradford for 30 years, and during that time I would have described myself as very actively anti-racist. I worked in social care. I did lots of work with children in Sure Start from global majority backgrounds. I did work with Southeast Asian communities that were struggling to access support at home and residential care and dementia care as it looked pre-2000, which was very much more sort of institutionalised, not co-produced. And then I moved to York, and I must say, I think I went to sleep. I had one conversation with somebody where I moved here as a social worker and did my ASW training very quickly in 2004. I had one experience, well, a few actually, where people didn't want to see me because of my surname, Vachikauskas. So I quickly realised that there were issues, but because I was white and I had a Yorkshire accent, all that went away. And I sort of carried on in my role, and I would describe myself as anti-racist. But looking back, I think that I was probably sleeping, really, and not being very active. And then I went to be the AMP lead in York 2 or 3 years ago, and began reading a lot more around, as Vava's talked about, the racial inequalities and inequity in mental health services. I looked at the Mental Health Act reforms and looked at the disproportionate number of people from global majorities detained, deaths in custody, accessing services. I have got a slide on that, but we'll move past it because it's been covered. I then did some research with, it's actually the National BAME Network, AMP Forum.
Yeah.
National BAME AMP Forum, not Leave Network, sorry. And we did some, we were looking at recruitment and retention of AMPs because there are so few in the country, and we interviewed them, and they very openly said that they would avoid permanent roles because they did not want to experience racism. They always experienced racism. It was bound to come. Or they would move on quickly from job to job. They felt there was institutional racism in organisations that wasn't acknowledged. They wouldn't progress to leadership roles, all the stuff we've heard about, being subject to fitness to practice and disciplinaries. And I did a lot. I was, you know, that moved me a lot. And then I did a lot more reading, listening, networking and reflecting. And I think one of the big things that supported me or helped me to move forward in my journey to be active is I moved outside of the bubble of York, and I was very much connected into the AMP Leads network, the regional network, the national network. And gradually, because I was in more of a strategic role, I began doing lots of research and development and connected with other people, and was very moved with that. So I found safe spaces with colleagues outside of my workplace, and I think that's vital. I think finding those safe spaces with individuals or in groups, it might be on a Teams, but you connect and things develop, and then you get validation around your views and opportunities to collaborate. And that's what really happened with me. I met Neil, I met my colleague Kirsten Bingham, who I did the research project with, and we moved on and did lots of training together. It wasn't easy, but what I would say is I shared the knowledge in my organisation that I had found and the evidence-based research and lots of the tools again and again and again. And it was hard, but I had to just keep going on, finding someone that would listen, finding someone that would understand what I was saying. In the end, I found we had a principal social worker at the time who was new and agreed to let me fund the allyship training with Neil because there wasn't anything on the agenda. That's since been addressed, but it wasn't an easy journey. Despite being in a leadership role, there isn't any money. And as people have said, anti-racist practice often goes to the bottom of the pile. It's the one where the meeting gets cut short or moved, or people say, we'll come back to that. We're really busy because we've got this to do or that to do. But you've got to keep going and just do it. And that's the key message. And we can skip to slide number 6 because I think we've covered everything around racial inequalities in the other session. So Neil, you wanted to talk about the safe space, or do you think we've done that?
No, I suppose I wanted to say that it was extraordinary for me that at the end of your training day and the one in Hull I did with Kirsten in a similar way to the way I did it with you, very similar. Two people from global majority, racialized minority backgrounds, social workers, felt they could kind of announce to the whole training attendees that they had felt they could share some of their difficult times, which they hadn't really felt safe to share for many years. And I suppose that was just a bit of a feedback on how safe spaces can work so effectively. Over to you, Hannah.
Thanks. Yeah, I think the sessions that we did both in York and in Hull were very similar. Mine focused on actually everybody was invited, but we had frontline practitioners and sort of team managers and practitioners come. We didn't have senior leadership, which has been fed back. So it was about creating a safe space and having no judgment. And I brought in the national context and the national data to sort of inform people. So it wasn't just about mental health, but it was social work as a whole. But that data is vital. We looked at the data around having a diverse workforce. And if you don't have the diverse workforce, you know, the impact on frontline social work. So we brought all that, but also we looked at the local data as well, because that seemed to really resonate. It resonated with me, and it resonated with the people that we did the training with, because it brought it back to them and the people they work with. And I would say that I think, as Vava or somebody said, the data is not good. It wasn't great. It was an independent organisation called Inclusive Equal Rights, and they're a grassroots organisation based in York that undertook this report, and they very much said that the data wasn't fully available. So that was part of the discussion. And again, it covered lots of things we've talked about. Very few people from racialised minorities working within the service, within social care, within professional roles, the majority working on 0 hours contracts at night and in minimum wage roles. And that was within all the organisations in York. So that was, thank you, someone's put that on. That was, so we looked at the makeup of York, and we looked at the fact that there were any people from global majority backgrounds in leadership in the hospital, trust, universities, college, council, anywhere. And then Neil did his work, which was absolutely astounding. And I think this is one of the most important things for me and for practitioners, and that was looking at acknowledging whiteness and privilege, and looking at the British Empire and colonialism and the legacy that it's left. And that sort of smacked a lot of people in the mouth. And it led to really good open discussions, because it's so frank and it's so open. And that led to our social workers opening up. I'll speed up because I'll realise we're going to run out of time.
That's
and
right.
The other thing we did, we looked at areas of good practice. We made sure it was interactive. And at the very beginning, I made sure I said there would be feedback and commitment for next steps and actions. So if we can move on to the next slide, and I'll just race through that very quickly because I think they're going to be shared. So basically, I fed it back. We've got commitments in York to move things forward. We're looking at anti-racist reflective supervision. That's been added in the induction. We've taken it to corporate. We're looking at training. So all that's moved forward, and that's absolutely fantastic. Neil's setting us help up an allyship forum. So that's amazing. I think we've only got a few minutes left. So if we move on to the next slide. Right. If we move, thank you.
Yeah. So I guess I just wanted to say a bit about this, because the top one describes, I would have to say, most organisations that I've done this training to have described their organisation as the top one, where Black History Month events happen and people's images are on the website. But the bottom one is where I think Hannah's dedicated to trying to create in the city of York. So I think it's just a really great kind of template for where you can start from sometimes nothing to a really developed process. Carry on.
Thank you. So if we skip to slide 10, because we've already covered lots of the, right. So I guess my key message to social workers who maybe don't feel they've got much power is that knowledge is power and understanding. Educate yourself, do the research, keep on learning, and just do it. It's your responsibility as a practitioner to do that. Your organisation isn't going to necessarily provide that for you. It's not all going to be there. You need to do it. I found LinkedIn was fantastic if it's free and you're on you're not earning very much money. I've put the Race Equality Network on there. There are so many more organisations. There's there is that Chantel B. Thomas is the founder of.
Anti-racist movement.
The anti-racist movement. There's so much stuff. Research in practice. Look out for microaggressions and challenge. Offer support and listen. Reflect on your own personal journey and your own awareness as you go along all the time. Don't wait for someone else. Just do it. Can we move on to the next slide, please?
Just a little word.
Okay.
Hannah. it was really just to say that what social workers have said to me at the end of some training sessions is that realising they could set up a allyship group for an hour and a half every 2 months was not going to drain anyone's budget, and it gave them kind of feelings towards being able to try and do it rather than waiting for management to decide whether it could happen or not.
Absolutely.
That's what I just wanted to say.
I'll skip very quickly to the next slide. So as we said, safe spaces, no, back one, please, sorry. Safe spaces can look like anything. It doesn't have to be a formal space. It doesn't have to be an allyship forum. It can be on a local or national network. It can be a space with one person. It can be something you've set up with peers. Take the time to be reflective and to be open and honest. Next slide, please. We can skip that. That's just about going back and thinking about where you are on there. Next slide. So this is absolutely fantastic. We're not going to do it now, obviously, but Shabnam Ahmed did this training with me. I did the DHSC leadership course, which was brilliant. She does the sack of privilege. She allowed me to share it. And this will help you take time as a frontline social worker to reflect on where you are on your personal journey. Where are you coming into this from? Are you at the beginning? Are you someone with lived experience of racism that's on your own journey? Are you an ally, an active ally, an activist? But sit and think about it and reflect on it, and also think about what others' sacks of privilege might be like and how heavy or weightless they may be. And the last slide, I think it's the last slide, are just questions. So is there anything you can take away today towards becoming a more active ally? Who can you share this with? Think about the domino effect. How might you share with others what you've learned today in order to influence change? There are different ways to share it other than having a conversation, you know, writing, pictures, recordings, anything. What actions could you take as a frontline practitioner? What do you want and need to know more about? Reach out. And what do you think's needed in your organisation to move things forward, or your team or your department, and take that back? Thank you.
Thank you.
Fabulous. Thank you very much to Neil and Hannah. A vast amount packed into that presentation. And just a reminder, I know if some people have just joined us, you will be getting all the slides and the whole presentation will be available on YouTube, so you will be able to catch up if you haven't seen all the presentations. I'd just like to sort of reflect on leaning into discomfort. We all like to be comfortable, don't we? We all like to stay in our little comfort zones, our little echo chambers, but the importance of leaning into the discomfort, maybe challenging ourselves, going into that less comfortable space and feeling more confident, or at least working towards feeling more confident to have those frank and open discussions, and acknowledging white privilege. It's something we don't do enough, I think. For those of us who do have white privilege, how we can not just think that we're an ally because we're not racist ourselves, but what does authentic allyship really mean? So if we can reflect maybe where we all are, all these presentations this morning will hopefully help us to reflect on where we all are on our own journey. And again, the concept of sacks of privilege really brings with it a really powerful image. So a lot of food for thought there. So thank you again to Hannah and Neil, and a reminder, questions in the chat, and we'll come back to the Q&A after our next presentation. So I'm going to introduce our next speakers, who are Richard, Bonnie and Duke, who are all here from Brent. Richard is a mental health support worker and a project coordinator of the Pathway project. Bonnie, an expert by experience in mental health, who offers peer support work in Brent. and Duke, who is the Adult Social Care Transformation Programme Manager and Co-Production and Community Partnership Lead, also in Brent. Hand over to you. Thank you. Oh, you're still on mute, Richard.
Hi, good morning, everyone. Good morning, all colleagues. I'd just like to introduce myself. My name is Richard Hay. I am a mental health support worker for the last 25 years, and I've also set up a community project in the borough from 2017. This project, why it began, this project at SJP, in 2017, after a deeply tragic period where 6 young people from all ethnic minority backgrounds died by suicide. I've actually had contact with these persons, these individuals. I then felt a strong need to respond after these heartbreaking losses. And for me, this exposed deep gaps in support, belonging, and cultural sensitive services for people struggling with mental health. So in response, I founded a community sports project, that's slide 2. It was designed as more than just a sports activity. It became a structured, safe space where people could connect and be supported and be seen. Next slide, please. What we built. This project serves as a therapeutic and social resources for clinicians can confidently refer the clients to. It helps address common barriers such as a lack of access to local facilities, social isolation, and the need for community-based psychology support, especially during periods of personal or clinical crisis. From the very beginning, everyone that engages with this program who joined was told that this project is theirs. They have ownership here, and that a sense of shared responsibility and collective belonging has shaped the art of what we do at SJP. Next slide, please. It's trusted by clinicians to offer preventative and crisis stage support. It bridges gaps where traditional service can't always reach, and it enhances continuity and the care of engagement. Next slide, please. So we'll incorporate 5 and 6 instead of the achievements. Real life impact. Over the past 7 years, I've seen real changes happening to the service users that attend the program. We receive countless referrals from clinicians, and this impact has been quite wide-reaching. Many participants have secured employment, return to education, and access housing. We've supported individuals through benefit applications, welfare issues. It's a safe space where people improve both their physical and mental health well-being. It offers consistency, crisis support, and acting as a community anchor where traditional service aren't enough. Importantly, it has helped reduce hospital admissions by offering early, ongoing support. And I must highlight that 47 participants have gained sports qualifications that have attended this project. First, sports FA level coaching certificates, fitness instructors, participants have become more qualified in terms of what they used to have before. And we've got one client who's actually set up his own cleaning business. Slide 7. Next slide, please. This is also a peer-led initiative. People come not only to receive help, but to offer it, to listen, support, and guide others. We use a therapeutic tools like the Team of Life, a narrative therapy approach rooted in support and teamwork. It's an inclusive environment where diversity is celebrated and everyone, regardless of background, is valued. I'd like to share the example of Bunny, who has been part of the, next slide, sorry. I'd like to share the example of Bunny, who has been part of the project for 7 years. She's grown through and always plays a key role in supporting others. Her journey embodies the values of hope, resilience, and contribution that this project stands for. I'd like to introduce you to Bonnie. Thank you.
Yeah. Hi there.
Oh.
My name is Bonnie. I'm an expert by experience, EBE. Sorry, one moment. Sorry about that. My name's Bonnie. I'm an expert by experience. I have had the experience of being on the Brent community mental health team when I was at my most vulnerable. I won't say as much as I have a short film, which I will now be sharing with you all, which will show the struggles with my mental health journey here. That was my video of my mental health journey, my short film I created. And that does say a lot, but now I will pass back on to Richard.
Thanks. Oops. Let's get that on. Thanks, Bonnie. Every time when I watch this video, it really gets me emotional. Anyway, why this works? Why this project works is fosters belonging and purpose. It celebrates diversity, and it's consistent, community-based, rooted, culturally aware, and it's a practical therapeutical alternative that complements clinical care. And a final message from me: it's not just a sports activity. It's about turning isolation into connection and transforming pain into purpose. And I hope you guys, my colleagues, receive this very well in terms of addressing and moving from words to action when it comes to supporting people in mental health. Thank you. I'll hand you over to Duke.
My name is Luke Tran, and I've led the co-production and community partnership program in Brent, and I can share some of my learnings from this work. I have the privilege to work with wonderful people like Richard and Bonnie in developing our co-production approach. Their stories are excellent examples of how lived experience can help us to understand and shape services. The Pathway project, run by the Silver Jubilee Trust on the Hendon Football Club site, in which Richard is the coordinator and coach and Bonnie is a peer facilitator, has received over 400 mental health referrals since 2017. The programme helps to prevent and reduce readmissions to hospitals, and it has prevented suicide and saved lives in Brent. The Silver Jubilee Park Foundation has hosted groups from the Jewish, Chinese and South Asian, Afro-Caribbean, Somali communities, and all faith groups, which shows that we can use the power of lived experience and community assets to inform and co-produce services within diverse communities to address health and structural inequalities. I believe that within our own communities, there are people like Richard and Bonnie who can help us to move from words to action. So, to become an anti-racist ally and practitioner, I think we can first start by developing our cultural intelligence and humility. This requires us to actively listen to understand the experiences of people from diverse backgrounds. Remember, people may be exposed to the same mental health system, which is Eurocentric and white, but they have unique experiences which are informed by the intersection of race, gender, sexual orientation, and class. These experiences can often be undervalued, neglected, and invisible in our services. We can act by developing relational practice and co-produce services by involving and employing individuals. In Brent, this could mean getting involved as a co-production champion, recruiting others with lived experience to attend co-production, resident advisory and inclusion groups, attend co-production board meetings and workshops, and to participate in service development projects. These activities should be accessible to people and they should be paid for taking responsibility to chair and facilitate. We should also work with local people to empower their communities to find solutions which affects them. Whenever possible, solutions should be co-designed and co-delivered to build trust, inclusion, and to ensure sustainability through shared ownership. And finally, we should have the courage and curiosity to do things differently and learn from these experiences through sharing power. As allies, we can decolonize the white Eurocentric mental health system and move it to a more inclusive anti-racist service. These points are not new, I recognize that, but it's always a challenge to implement. And I'm not suggesting our co-production conversations are easy, and there is a lot more to embed this in our services here. However, when we approach this work by sharing power and responsibility through co-production and community partnerships, the journey to improve services for local residents can become easier, impactful, and even more enjoyable. Will you join us to take action? Next slide, please. That's it. Thank you.
Thank you very much to Duke, Bonnie and Richard. And as we've seen in the chat, lots of people responding, Bonnie, to your film in particular. It's incredibly powerful. It's always powerful to hear people's own experiences. But hearing about, I think the phrase you used was your journey to your true self. We often hear the term recovery. I much prefer this, the personal journey to your true self. So that concludes our presentations for this morning. If all of our speakers can now pop their cameras back on, we'll move to our Q&A session. Back to Hannah, Neil, Tricia, Fava. Fabulous. Okay, I'll ask the first question. I'll have chair's privilege of asking the first question, and that's of all our speakers really, to say what have our panel members today learned from hearing from other presentations? I don't know if anyone has any thoughts on that and who'd like to go first. Hannah.
Well, I think I'm still bowled over by what Bonnie shared with us, because we hear from people speaking about their organisations and the practice and good practice and things like that all the time. But to hear somebody else's experience from when they're rock bottom, and, you know, to understand it and then to feel inspired as they come through it and to really think about what we can do differently. I'm still processing it, but it was fantastic. So I've learned more than I even know yet, because a lot of it will land as the days go on. So, and I'll watch it again. So thank you so much, Bonnie.
Thank you, Hannah. Any other thoughts from our speakers? Neil.
Yeah, I wanted to say thank you to Mira and her colleagues to show the pressures involved in leadership for people from racialised minority, global majority backgrounds, and how it's a difficult process all the way through. And yes, it's much needed, but even when it happens, it's really difficult to. So I thought that was very honest and revealing, really, and thank you for that.
Thank you. Any other thoughts from any of our speakers before I open up to the other questions for the panel? Okay. So, oh, Duke.
Very good.
I think there's lots of Firstly, I think I equally acknowledge the fact that each time Richard and I watch Bonnie's video, we're both touched by it. It's a real journey, and it's a journey of actually of bravery, and not many people have that in them, and it's also a testament to the good work that Richard and SJP has done within the borough. And I do, on reflection, think that really, I think to be a good ally, you also you have to be by nature a good worker as well, and you need to work with people who are less perhaps in a much more difficult position than others, and you need to respond with compassion, with that humility and cultural sensitivity, and I think it's really important that through co-production we can find that opportunity, and it's all linked. I think it's about sharing that power and that privilege and acting on that. So I'd say there are other people as well, I'm sure, within your own communities who you can look to guide yourselves to develop as a practitioner, as a better ally, and to improve our services. And I think we need more of these opportunities to celebrate that too. So that would be my point, and I really enjoy seeing the good work that's being done through the RES and the training that Neil and Hannah has completed. So yeah, so looking forward to more of these opportunities. Thank you.
Thank you, Duke. Richard.
I just want to say, Duke, if you put your... I've always said that this could actually be done in other boroughs, because the core elements is peer support, therapeutic support, and a consistent space. And I really believe that this can be adapted elsewhere, with the key local partners and trust and cultural alignment. I think it can be, this can be scalable and roll out to other boroughs. And I really love to see that going forward.
Yeah, thank you, Richard. I know, as we've said, the presentations and this programme this morning will be shared on YouTube. Bonnie's video won't be part of...
Mary, you're on mute.
No, we can hear Mary.
No,
you're not on mute.
I think because you three are in the same room, you're all switching between mute and turning your volumes down, so we're not getting the echo. I think I'm on mute. I'm not on mute, rather. I'm just checking, Bonnie. There's been a question to say, would you mind if people share your video, or is that something you'd rather keep to a limited distribution? Do you have any thoughts on that?
You're muted, Bonnie.
Just to say, we have previously agreed with Bonnie, just while you're waiting to put your mute on, Bonnie, that we won't be sharing the video and we won't be including it in this recording when we upload it to YouTube. So if Bonnie has a link to a video, Bonnie, if you want to share that with me, we will then distribute. If you've got your own link you want us to share on your behalf.
Yeah, thank you for that.
Thanks, Denise. Thanks, Bonnie. It's incredibly powerful, but clearly it's important to you to have some ownership over it being shared. I'll move on to questions. So we have a question for the panel from Jennifer Burton. How can we capture the views of people from the global ethnic majority about their experiences in using mental health services? Information available from research reflects lower representations in verbal and digital feedback systems from individuals from the global majority. A really important question. How do we get the voices? How do we make sure voices are heard? Because I'm wondering, is there something about being much more targeted and proactive, going out and seeking them rather than expecting people to give them in the very generic way that organisations can send surveys out or have feedback options? Neil, I think you're first.
Hi. Yeah, I would emphasise the fact in my long experience of working in mental health with people from those communities over the years that there's a certain lack of trust which would make people be a little bit reticent about giving their views forward, since they've seen nothing change much in about 40 years. So you've got to tackle that issue. And I think projects like the ones that Richard and Bonnie are involved in are already generating huge amounts of trust with people, because they're successful and they're bringing people through in the way they want to, and outside of mental health medication sort of settings. And I think there's a message there for, and in terms of the PCREF, which is supposed to be, being implemented across the whole country, there are trusts who do better engagement with their communities. And South London and Maudsley, which is the one who pretty much started the whole thing going, have had, I think it'd be fair to say that their engagement strategy with local communities in Lewisham and Brixton and those sort of places has been extremely effective, because they listen and they do all the right things. So I think earning trust, I suppose, is my kind of summary message before you can do it.
Yeah, absolutely. And what's the point? Nothing's changed is a real issue as well. It's an issue getting feedback generally, but even more so for people from these communities. Hannah.
On sort of a practical note, well, on any note really, I mean, the role of the AMP and the social worker is to sort of look at the social models of mental health and to get that feedback. And I know that they're doing it in some other areas, they're doing it in Hull. So we're starting with going back and getting the feedback from individuals who've been detained under the Mental Health Act or experienced Section 136. We're trying to develop a QR code, but it is also about taking the time to go back and create a safe space. When we're practicing, especially as an AMP, we should create that safe space. We should really see the person on their own and have that relationship. That's something we're tackling in our team. You know, you see the person on your own, you start building that relationship, and then there's a space to go back, collect the feedback there if you kind of bring it back and it's qualitative. It's not just about a tick box.
Absolutely. Richard.
I totally agree with Anna, because what we found that in the years that I've run in this project, a non-clinical environment fosters trust and recovery. And I think also it enhances the continuity of care and engagement. And as I said before, it's a space where clinicians can use. And to my, it's important that we actually go forward in this direction, because as Duke says in part of the collaboration co-production, we can design the services and create services as much as we want, but at the same time, it needs to be safe. It needs to be consistency, same time every place. And as you know, we've got a problem with retention and stuff like that. So I think the first place is to have a non-clinical environment that fosters trust. And I think we can go from there.
Thank you, Richard. And Duke.
Hello.
Yes, we can hear you.
Great. Sorry. Yes, I think leaning on co-production coordinators to help you engage with the community and developing that knowledge of your community is helpful. So, you know, advocating for more co-production work, and even, you know, getting if you can get a full-time, that's great. If you can get a part-time EFT co-production lead in your service would really be helpful across the board, and that's certainly what we're finding. Also, you know, you may have seen on LinkedIn, Robert has, circulated the latest guidance on suicide, best practice on suicide assessment, safety assessment, formulation, and action and planning. And that's been really useful. And if you read that, you'd find that, again, it really focus on relational approaches it's really important that we understand our communities well, and be dynamic in assessing risks. So risks can change. So reliant on just stratified, formulaic risk assessment is no longer good enough. I think that we really need to have that biopsychosocial perspective and a community-based one, and that I see as the way forward. So yeah, definitely all those points, including the importance of engaging with people with lived experience is critical in moving forward to becoming more inclusive and becoming a better ally, I think.
I'm not sure if we've lost Mary there momentarily. Richard, did you have your hand up? Did you want to come in? If you just want to unmute. Thanks.
Apologies, I
had someone
very insistent ringing my door.
For the last 7 years, I mean, since 2017, I tend to, people sometimes ask me, how do I assess the needs of the participant? And I said, really, it's just a relational assessment, really, talking with them regularly, building trust, drawing them the therapeutic tools, like the narrative therapy, talking therapy, team of life, and when needed, really. And we collaborate with referring clinicians for a more formal needs review and stuff like that. So I think the relational assessment is a key thing going forward to be actually, because, what I often find, they report back, they feel much more part of the assessment also. So I think that's a key thing we need to look at, how we use that informally.
Yeah, and remembering that it's not their responsibility to engage with us. It's about us finding ways to engage, communicate, build relationships. Sometimes, I mean, it's the same way generally in mental health services. We hear about people who don't engage or disengage. And I think there's a synergy across here. It's not their responsibility to engage with us. It's about us, our responsibilities as the people holding the power and looking for the information. It's good that we want to ask the questions, but we need to think about how we ask them and how we engage and how we give some assurance that it's of value and that it may and certainly should lead to change, because we've been promising change for a very long time. What's going to be different now? Really useful conversation there. Move on to the next question from Sarah Liptrot, who notes that the university she works for has noted our students have experienced racism when on placement, and we struggle to know how to challenge this. Do the panel have any suggestions? I don't know whether that's racism from service users, from colleagues, or all of the above, but any thoughts or observations from the panel? Mira.
Thank you. This is one of the things that routinely happens for our global majority workforce, and there are a number of things that I am unsettled by. One of them is the universities that might be supporting the people in their roles. I'm not sure where they are in some of this anti-racist practice. Some are really good and some are not. If you were to look at who, the lecturers in universities, there is a displacement of the amount are often white. So there is that to look at, and I think we all have a role in articulating what universities need to be doing. And I think we also need to provide back in the ranch, if you like, back at work, again, who is assessing. Is it white people assessing? Are there conversations about recognising that there are disparities? So just having that discussion about, do we have too many of our global majority people being held back, and why is that happening, and unpicking the racism that is often there. So that for me is where I would come from.
Absolutely, thank you, Mira. Neil.
Yeah, there was someone here attending from Bradford University who, in the chat earlier, put that they found it very difficult with students coming back from placements saying that they'd had racism towards them. And I reflected that I have 3 friends who work at University of Winchester who they told me all the same things exactly. And they said that they are trying their hardest to give the students a voice, to build up their confidence. And the local authority, or the 2 or 3 that they're working with, aren't doing anything. Now, that's because, it can be the other way around, Miri, is what I'm trying to say. I think that's the thing that people have to realise. It's not a one-way process that I've come across, but it's a hard one to crack. And the other thing I wanted to say is that in my training sessions, people have come forward and said some of the issues that the global majority social workers have had when they've been turned away from or racially abused when they're trying to deliver the service. And there are some managers who, it's been reported, been absolutely horrendous, and said, "Oh, give them a direct payment, and they can get someone who they want," which is kind of about the worst thing I've ever heard, I think, in terms of a management situation in a local authority. So I think it's these are really important things about how managements of organisations are held to account for supporting their global majority staff.
Thank you, Neil. Bava.
Thank you, Mary. Just to add on what Mira and Neil explained, I think it's really critical. First, to show solidarity and to stand with the person who's experiencing those behaviors and those hatred. So I would hope that you would reach out to that person and validate their emotions. That this is happening and so on and so forth, and explore how you can safeguard their well-being and their placement moving forward. There is a book which has a quote which speaks a lot to me. It's called Day by Elie Wiesel. Elie Wiesel survived the Holocaust, and in that book, he's written 2 really, really interesting books for me. One is called Day, one is called Night. And in that book, there is an argument he makes. He sort of says, in life, you find yourself before scenarios and situations in which you're powerless to change anything. You don't have enough power, enough strength to change things the way you wanted to change. But what you must never fail to do is to register how you felt. So in this scenario, really critical for you to register for history how you felt, and so be there for the person who's the victim, and take actions against those who are the perpetrators.
Thank you, Vava. And got another question from Jennifer. It's great to hear about how champions of anti-discriminatory practice are being actively encouraged in your organisation. I'm not sure which organisation that was. That may be Brent. In empowering others, how can we work together on our unconscious bias to raise further awareness, create shared values and principles, and promote anti-discriminatory and anti-oppressive practice? Well, that is the question. Hannah.
Thanks. I think that is sort of what I was getting at in the presentation. Yeah. It's about...
She may have been referring to your presentation in that one, I think, Hannah. Yeah.
It's about, so the key messages are about, and it links to the last question as well, sort of reflecting on yourself and where you are on your journey as an ally, and understanding how, what work you need to do and what you need to do to take things forward, to challenge things and move things forward. I also think like I said, every tiny thing that you do that you might think is not significant really, really is significant. So as Baba said, it might be about challenging something. I really do think knowledge is power, and I do think that by having information as well, because it depends who your audience is, we've got to be honest. If you're wanting to challenge racism to leadership or to other people that are not aware or enlightened in any way, getting it down in a way that they will relate to, I don't think that's kind of copping out. I think that's targeting your audience and showing your knowledge and your understanding and, you know, getting it down in the right way. It's just not easy. As I said, a lot of organisations don't have the support and the infrastructures in place, but, you know, it's about connecting with other people, finding allies within your organisation, opening up conversations, leaning into your discomfort, being brave, all those things. And things will happen. It's about the patience, which is not easy because it's so frustrating, but getting support outside of your organisation is a key thing, because if it's happening in there, reach out to other spaces, and there are loads that we've talked about, and you'll get confidence and courage and support from there as well to then take back, rather than operating in that bubble where you feel the racism and oppression and lack of understanding exists. Go outside of it and learn loads and connect with people.
We're back into that leaning into discomfort element that you raised, Hannah, aren't we? Vava.
Yeah, hugely supportive of Hannah's view. I would like to just expand it a little bit. It's really, really critical that we that we come to terms with, you know, a really significant part of these conversations, which is this. Every single NHS trust in the country, every single local authority in the country employ decent human beings. Those are liberal human beings. People define themselves as liberal, justice loving, and so on and so forth. People who call themselves allies, and so forth. And every single racial inequities we are talking about have not been instigated by the far right. The reason a single NHS personnel or local authority are not employing anyone from the far right who is over-detaining Black people, over-diagnosing Black people with psychosis, and so on and so forth. In other words, the people who police access to services, experience with services, outcome from services are the people who are over-detaining Black minority people, are the people who are over-diagnosing Black and minority people with psychosis and serious mental illness, are the people who, you know, keeping people on CTOs and so on and so forth. In other words, we are talking to ourselves. Okay, here we are not talking about, you know, the elephant in the room in this conversation is not the far right. It's not members of the Reform Party. It's not, you know, the race rioters in England last year and so forth. It's ourselves. Okay, there would not have been the detentions under the Mental Health Act that we are seeing against Black and minority people if social worker had not agreed to those detentions. Okay, so we desperately need to talk to ourselves, and often we have this conversation as if we are fighting against some sort of oppression outside and so on. Yes, there is a system, I agree, and so forth. We are the oppressions. Now, how are we practicing? Okay, how are we looking ourselves in the mirror? Okay, and I think that's just really, really critical. It's not the outside. This is an internal matter that we need to address.
Absolutely. Thank you, Vava. And the last response to this question, we've got a couple more questions I'd like to squeeze in before the end, but Dick, have you got a response to this one?
Yes. Hello. Yes, definitely. And following from Bava's point, you know, we're not victims here. We are survivors, and I think we've got more strength than we can. You know, we often forget that we've got strengths and we've got allies and we've got shared experience and we've got knowledge, we've got history, we've got culture. You know, if anything, you know, people like Bonnie has shown us that, you know, that it's possible to actually not only go through a difficult journeys, but actually with support, with Richard and other peers, etc., we can do this together. And I think what we want to say in this session really is that through taking that kind of responsibility for ourselves, because no one's going to help us, you know, I think we've got to do it, and we've got to do it together. And I think that's the beauty of allyship, is that when we do that, that journey shared is a pressured halved, you know, that difficulty halved, and it really shines a light in terms of our struggles and our understanding of our struggles and of our peers. But definitely, I want to reinforce the point here that moving from words to action requires us to see ourselves as survivors with strengths, and we can make a difference together. Okay.
Thank you, Duke. Powerful message there. I think hopefully this will be a very quick answer to this question from Lynn Watson, who's interested in the safe spaces as a practitioner and social worker from the global minority. Where can she and some of us plug into that?
So is that a question about the safe spaces? I was typing something to Richard to respond to is what he just said.
How can people link in with the safe spaces?
The safe spaces that Neil and I talked about are,
yeah, I think so, yeah.
Linking in with the safe spaces, well, I'd say, I put a slide up to talk about what is a safe space, and it's reaching out for those safe spaces. So Neil's helping me to set up an allyship forum in York. That's been a while coming. I think in terms of, I found safe spaces when I reached out outside of my organisation, and I found safe spaces in the AMP Leads network and in people that I had things in common with that were on the same page. I found safe spaces from individuals and from other networks, and I'd say a safe space is somewhere where you can be open and honest, and you can create those safe spaces yourself. You know, you can reach out and find them and start it. And again, it's about being brave, because you might have to put some trust and be brave and think, is this a safe space? I've got to start this interaction. I've got to create this safe space, and it might not go well. You know, there's always that option. I've found that sometimes I've been quite shocked at how people are, but you know, it's easier in my position. I acknowledge that with white privilege, but I would say you have to just trust and try. And a safe space, again, as I've said, is about being open and honest and having those difficult conversations. And they might start out tentatively and grow and grow and grow. There's no definition of there's no specific safe space.
Thank you, Hannah. So if we can't find them, it's our job to create them, or at least instigate them. I'm not sure. Ooh, we've got
Vava
one
has
more.
his hand up, Mary. Sorry.
Oh, sorry, Vava. Missed that.
So maybe just a couple of things. So BASW offers a lot of those safe space. Reach out to us. There is a lot that we can offer, from sort of guidance to everything you would need, basically. So there is that. Definitely the AMP Lead network is a good safe place. For those who identify as Black and minority, there is ARM, which is a platform of Black and minority women, offering some amazing support for Black and minority women in relation to those things. And men are also welcome, but we are not formally part of it. But so those are the three things I would suggest. Definitely BASW, the forum, and ARM are the three ones which I have found incredibly useful.
Sorry, I've just put the BAMAMP forum on there as well that was on the slide. Thanks.
Thanks, Hannah. Thanks, Faba, for that. There's one last question. We don't really have time to do it, but I'm taking chair's privilege. And this is from Paul McAlary. Apologies if I've mispronounced your name, Paul, who's a team manager in AMP in Bristol, wanting to know generally what organisations are doing to address recruitment and retention of social workers in general, but particularly social workers from racially minoritised communities. Do we know of any employers who are doing this well? I suppose that's the quick answer to this question, because what are we doing is a huge answer. But do we know anywhere where it's working well, who we could maybe direct people to? Or is the elephant in the room that it's an issue for everyone?
Well, I wanted to push this over to you, Mary. I think your local authorities won Best Employer recently, haven't you? Tell us the good thing you're doing, the good work your local authorities are doing.
We're thinking, was that Hackney or Tower Hamlets? I'm not sure. My trust works across 7 local authorities, so I'm thinking I mean, for obvious reasons, many of the local authorities that my trust works with, so East London NHS Foundation Trust, so we have trusts in East and Central London and in Luton and Bedfordshire. And I think one of the things that we've been trying to do is recognise that we want to recruit social workers who look like the communities that we're trying to work with. And I don't want to mention particular social work training programmes, but there are particular routes into social work that are maybe more accessible for people from the global majority, and particularly people who live in the communities we want to work with and are familiar with the specific communities in which we're based and which we are there to support. So my view would be it's around identifying what are the barriers, what are the routes in to support those communities to train as social workers. Particularly apprenticeship routes are more accessible. They can be incredibly challenging, especially speaking as someone working the NHS at the moment. The NHS is more financially challenged than it's ever been, and I'm pretty sure local authorities are in similar positions. So apprenticeship programmes can be expensive. You've got to find posts for people to be appointed to do their training, but that is a really successful route in for those communities. Yeah, it's a difficult one, and then recognising that you need safe spaces. We're back to Hannah's point about safe spaces for staff, reflective practice, continuing professional development, appropriate professional supervision. It's don't assume that people are self-supporting and people will find that for themselves. So lean into that uncomfortable space. I'm going to be using that phrase a lot, but lean into that uncomfortable space and ask people what it is they need as well. But yes, not easy at all, but it's about being proactive and about having the responsibility as an organisation. I'm very lucky with the organisation I work with, as I mentioned at the beginning, but don't take any of it for granted, particularly with the narratives, the unfortunate narratives, I'd go as far to say, that have come from our government this week. It was, well, soul destroying in many ways to hear the comments about workers, for them to be described as unskilled to start with, but workers working in social care. Many of us work with those colleagues, they work with our providers, they work with us. To hear them described as unskilled and to be saying we don't want you anymore, that's a really difficult message. So one of the things I would say is what responsibility are we taking to go out and speak to those colleagues who will be feeling a lot of things this week, hearing those messages hit the headlines. On that note, we've run out of time. Oh, Richard, did you just want to come in? Sorry.
Well, on that very note that you mentioned, Mary, I've recently done some research with some of the cohorts that we work with, and what came out of that was a lot of the EBs, a lot of the clients that we work with, you know, actually expressed the need to be able to support them to get jobs within the NHS, to be able to get trained to become social workers. And I think we're missing a point here. We're missing a nice little niche here where we could actually start focusing a lot of the training and support for people with lived experience. And that really reflects, if you look at the admission rate, it really reflects what we're talking about here. And if we can get more of those people in to get that professional training, because what I found is the transition from somebody with mental health concerns, and then when we start looking at the training program that I've actually provided, for them to go into a statutory organization, it brings fears, anxiety, because they don't know how the other side works. And I think we need to start look at how we're going to recruit people with lived experience, especially, you know, having an hospital admission or some years in mental health services. So I think we're missing a trick there. We should really focus on trying getting a lot of students in from that cohort. Yeah, that's what I wanted to add to what you were saying.
Absolutely. And the responsibility there is multi-level. It's about how we're approaching that within individual organisations and those of us in leadership roles, how we're approaching it, but then nationally, how are our national organisations reaching into that space as well. On that note, I just want to again thank all of our speakers for their presentations today. Been a hugely positive response from everyone who's joined us. I think we had over 100 people with us, dipping in and out throughout the morning. So thank you again, and thank you to Robert in his absence for being part of organising today's session. Enjoy the rest of your days.